Where are you from?
Uganda.
What's your role in the conference?
I've come to speak about the role of mobile technology in turning the tide on HIV/AIDS on behalf of Text to Change.
What kind of... Oh, really? Okay,
yeah,
great.
Yeah.
What do you think of... We've been asking people, you know, what do you think of circumcision as HIV prevention?
Yeah, we've also done mobile technology programs on circumcision and turning the tide on HIV/AIDS, and we found that, of course, people are misunderstanding it, that as long as I'm circumcised, then I won't get HIV/AIDS. But no, we're trying to tell them that circumcision reduces the risk of contracting HIV/AIDS.
But you still have to wear a condom.
Yes.
So if you have to wear a condom, what's the point of being circumcised?
It says that there's a certain percentage that it reduces the risk.
Even if they're wearing a condom?
Yes.
Or is it only if they're not wearing a condom?
if they're wearing a condom, even when they're not wearing a condom.
Oh, okay. Yeah. So it only helps if you're not wearing a condom.
It can help to a certain extent. Your risks are lower.
Right. But if you're wearing a condom, it's worthless.
It's still the same. It's still the same. But when you don't wear a condom and you're circumcised, the risks of contracting the HIV
virus. So if you're gonna wear a condom, there's no point to getting circumcised. Is that true?
I wouldn't say so.
Why?
I wouldn't say so. At all times, I would still say wear a condom.
No. Oh yeah, I know. But if you're gonna wear a condom, there's no point in being circumcised. Don't get circumcised, right?
Yeah, but in Africa it's different.
When people go in for circumcision, do you tell them about the sexual problems that circumcision can cause?
Yes, we do, and then we remind them on how to treat their wound and not
you tell them that it can cause a significant loss of sexual pleasure?
No, it doesn't. Actually, in Africa, it's even it sells more when you're circumcised than when you're
not. Really?
Yeah.
Is that a scientific study?
No, but it's.
Well, what if I told you there was a study of 10,000 men and their partners in Denmark last year that showed that circumcised
Denmark, in Africa,
that showed that circumcised men were several times more likely to have problems in their partners reaching orgasm.
I think if it's not done well, but for us, I think in Africa, actually from long time ago, traditionally, the men are preferred to be circumcised.
But you know that
for health purposes.
Yeah, well, they do that to girls in a lot of countries too, though, right?
Yeah, they also do it to girls, but we are trying to reduce that as well, because actually that is spreading HIV.
But you know that also circumcising men in unsterile conditions also increases HIV.
Yes.
So why don't we try to reduce that too?
I don't know.
Doesn't it seem a little biased? Doesn't it seem a little sexist?
No.
No?
No, it doesn't.
It doesn't?
It doesn't.
Really? Why not?
I don't think so.
Should we do studies to see if female circumcision, when done in sterile environments, also reduces HIV?
No.
Why not?
I think it's very inhuman to really circumcise females.
Oh, it is?
Yeah.
But it's not inhuman to circumcise males?
No, it's not.
And you don't find that sexist at all?
No, I don't.
What if I told you that there was a study that showed circumcision amputates the 5 most sensitive parts of the penis, including thousands of erogenous nerve endings?
It depends on the way you do it.
But you don't think the same is true for female circumcision?
No, it's not, because what happens to the female circumcision, why it is done in a certain culture in Uganda, is that they want to stop the women from sleeping around.
What if I told you that the main purpose of male circumcision was also to reduce sexual pleasure?
No, it's not. It's actually mainly for health purposes and to be able to... Yeah.
Health purposes?
Yes.
So you think you think it was healthy to get circumcised with a dirty knife in the bush? That's funny.